Ayan, medyo klaro naman po ba ako? Kasi kanina ko pa inaayos ang internet ko. Ayaw niya makisama ngayon. Ayan. So, time check po, 1:10 na po. So, I guess we'll have to start na our product training. Baka kasi busy si Doc. So, ayan. Again po, good afternoon po sa lahat ng nandito. Ako po si Camille, Marketing Executive ng GPAX International, and ako po yung magiging host po ninyo for today. So, ang ating topic for today is about Omni Fresh Plus Soap. Ayan, sino-sino po ba yung mga gumagamit dito ng ating Omni Fresh Plus? So, ang ating speaker for today is none other than DPCOM.
Hello, good afternoon.
Good afternoon, Doc.
Good afternoon po. Okay.
Hi, Doc. You can start your presentation, Doc Ryan.
Okay, sige pa. Okay, good afternoon. I am Dr. Raymond De Hoya. I'm a doctor by profession. I'm a diplomate of the Philippine College of Occupational Medicine. I'm a company doctor in various companies. Am I loud and clear sa inyo?
Yes.
Loud and clear. Okay, that's good. So I'm here to discuss about the skin. The skin is our largest organ in the body. So it serves as a protection from the external environment. It protects us from infection, from temperature changes, from many risk factors that harm the skin. It could be foreign bodies or toxic chemicals as well as free radicals. These free radicals induces damage to our skin and brings up diseases. Our skin is composed of three layers. So ang ating skin may tatlong layers, and these are the protection serves the building blocks of the protection of the skin. It's the topmost layer. The first layer is our epidermis. The epidermis is the one that's the front liner that blocks the infection. It blocks the external foreign bodies in our body, and it is the one that handles and manages the extreme temperature changes.
Epidermis.
Is
Layer
our
1,
epidermis.
epidermis.
Yes. And our second layer is the dermis. The dermis is the
Epidermis
dermis is the layer underneath the dermis. So pinakataas yung epidermis, the second dermis. It is the one that has the connective tissues. Yung connective tissues, they're the one that maintains the integrity of the skin. So it is the fortification of the skin, and it has the nerve endings. That is why we feel sensation, we feel touch, we feel pain through these nerve endings in the in the dermis. Then the third layer is our subcutaneous tissue. The subcutaneous tissue is the underneath the dermis. It has the fat cells under our skin. It has the blood vessels in which they deliver the nutrients to the skin, the whole skin. And it has the immune system. It has the immune cells that protects the skin, and it has the antioxidants that reduce the free radicals and reduce the toxins. So this is the vital role of our subcutaneous layer. So these are the three layers of the skin: the epidermis, the dermis, and the subcutaneous layer. These skin layers are affected by infamous skin diseases. These skin diseases varies and are large in number. For example, is acne or pimples, infection, immunological imbalances, as well as allergies. So these are the infamous skin diseases that we see today. And these skin diseases bring about a lots of stress, a lots of problems in our day-to-day life, because we as a human beings, we are really we are visual learners, and we perceive the world visually. So if we see these skin problems, it disturbs us in our everyday lives. It brings stress. That's why keeping our skin healthy is very important, and keeping our skin safe is important, especially at this time. These infamous skin diseases, besides these infections, they also have this immunological imbalances. So there's always a problem as well in our immune system and exposure from free radicals. So these are very stressful indeed. Today, I'm going to share to you OmniFresh Plus soap and OmniFresh Plus cream. OmniFresh Plus soap and OmniFresh Plus cream, they have natural ingredients. They are highly organic. They also have essential amino acids. Besides the essential amino acids, they have coconut extracts and other natural ingredients that help alleviate the symptoms of these skin problems. First, I would like to discuss about the Omni Fresh Plus soap and its directions of use. Sa ating soap, ginagamit natin po ito pag when we take a bath, when we wash our face, and when we wash our hands. So, itong Omni Fresh Plus soap, we rinse it with water. Then, yung nagfo-form na soap suds, itong soap suds, ito yung ilalagay po natin. This is where we put in the skin problem area, for example, our hands. We put the soap suds, then for 1 to 2 minutes, leave the soap suds. After which, you can rinse it with water. Pwede mo na siyang banlawan or hugasan po. Important thing is, you leave the soap suds for 1 to 2 minutes. Then, you do this once a day or 2 to 3 times a day as needed. So every time you take a bath, you wash your face or you wash your hands, we do this, the soap suds of the soap we put in the skin. Then our Omni Fresh Plus cream, this is our leave-on cream. We apply this after taking a bath, after we wash our face, or after we wash our hands. So our Omni Fresh Plus cream, we put it in the skin area where there's a skin disease. And same as the soap, once a day, we apply it once a day or 2 to 3 times a day after bath or after washing. So again, once a day or 2 to 3 times a day as needed. The soap and cream, they ease the symptoms of these skin diseases. And there are no approved therapeutic claims. Then we have certain frequently asked questions about these the OmniFresh Plus cream and OmniFresh Plus soap. So one of the common questions I encounter is OmniFresh Plus safe for young adults, elderly, to pregnant women, or to lactating women? Yes, our OmniFresh Plus soap and cream are safe for the young adults, for the adults, lactating women, pregnant women, and the elderly. Then another frequently asked question is this: does it have any side effects? Does it have any contraindications? None. They have no side effects, no contraindications. So, pag in-apply mo yung soap at cream, kahit man magsabay ka or even you put other creams, other lotions, or you apply other soaps in your body, the effect will still be the same. They will still uh, alleviate the symptoms of the skin problem. They will there will be no decrease in the effect. So it's still effective even though you put other creams or lotion. Even if you take maintenance medications or even if you take vitamins, there will be no contraindications. There will be no bad effects. So you can still apply the soap and cream with the other uh, creams, lotions, or other medications or vitamins. And the cream and the soap, again, they contain natural ingredients, essential amino acids, which is the symptoms of the skin problem. So that's my presentation for today. Thank you. Um, Do you have any questions regarding OmniFresh?
Hi everyone. So I'll be taking over from Miss Camille because she was having a bad internet connection. So, do you have any questions for Dr. Raymond about OmniFresh?
Yes, ma'am.
Right there. Go ahead po.
Ay, hello po. Doc, good afternoon po.
Hello, good afternoon po, sir.
I'm Marvin from Pasig po, Marvin Agaton.
Yes,
Doc, I'm suffering, meron po akong ngayon, may parang mga tumubo sa tiyan ko na parang pula, na bilog-bilog,
yes,
parang
sir.
pantal po. Um,
Yes, sir.
para sa inyo, Doc, ano po kaya yung mga gano'n? Kasi wala naman po akong allergy sa food or anything
Yes, sir.
since birth
Yes, sir.
po. Kahit ano naman kinakain ko po. Pero lately po, parang may mga lumalabas po na ganun. And sobrang makati siya. Although ginagamit ko na po yung ngayon, yung products natin.
Yes, sir.
And actually, nagsasubside naman. Kaya lang, hindi ko lang po, gusto ko lang po malaman kung ano po kaya yun.
Actually, sir, thank you for your question, Sir Marvin. So, what happened po dun sa rashes nyo? It's that it's more of pa rin po siya allergy. It's an allergic reaction. So, our allergy, usually it's not just coming from food, not just coming from medications. Pwede rin po siya stress related. So at this stress, it reduces our immune system. There's increase in free radicals. So what happens is there is an increased chance of having an allergic reaction. So usually we get these allergic reactions when we have less than 6 hours of sleep. So kung kulang tayo ng tulog, kulang ng 6 hours ng tulog, pwede rin po pag expose tayo sa magulong panahon, yung bigla pong iinit, sobrang init, tapos biglang uulan, tapos bukod po doon, napuyat tayo. So from my patients in my different companies, common po ito na pagpuyat po or pag kulang sa tulog, biglang naambunan or biglang na-expose po sa mainit na araw, tendency, nagkakaroon po ng allergy doon po sa any part ng skin natin. Pwede po sa tiyan or sa chest. So, this could be the reason why nagkaka-trigger kayo ng allergic reactions. Our OmniFresh soap and cream, they will alleviate your itchiness, the symptoms of these allergies. And besides that, I would still recommend na you consult to a dermatologist for the treatment of these allergic reactions. So usually the dermatologists are the experts that can help you. Usually there are dermatologists who are available online. Since at this time of pandemic, we need to stay safe, not to go outside moderately. So I would suggest for experts' opinion, we go to a dermatologist who can facilitate you online. So, yun po, Sir Marvin.
Thank you po,
Alright.
Doc.
Ayan.
Okay.
Thank you po.
One
And
question.
then, okay, go ahead.
Hello.
Hello.
Hello, ma'am.
Hello, sir.
Yeah.
Hello.
Hi, sir. I have just two questions kasi sa mga clients ko, no? One question, ito usually na-encounter ko, yung parang tinatawag nila na healing crisis. I've had cases po kasi na pag ina-apply nila yung OmniFresh, maybe after a few hours, parang yung sa halip na mag-alleviate yung symptoms, parang mas namamaga pa siya. I believe it happened around 7 or 8 times already. So, that's one question. So, yung kung healing crisis, does it really happen or meron bang other factors to consider? And my second question is, Is it also okay to use Omnifresh soap or cream for those people na mayroong external or let's say external na hemorrhoids? So two questions po.
Okay. Thank you, sir, for the questions. I appreciate it. And these are interesting questions, actually. So I'll answer your first question. For our first question, usually our OmniFresh Plus cream and soap, they have this initial reaction to our skin. So within 1 to 2 weeks, they have this initial reaction. It means that the essential amino acids, they eliminate the free radicals. They control the immune system. They reduce the free radicals. Usually, it's an inflammation. Ito pong inflammation, they usually start in the first 1 to 2 weeks during the application of OmniFresh. But after that, after 1 to 2 weeks, it usually subsides. Parang lang po, lumalaban po, nag-alleviate ng OmniFresh cream at soap yung symptoms, yung irritation. Yung alleviation po, initial reaction, talagang nag-aano siya, yung nagkakaroon ng inflammation. So, binabawasan po niya unti-unti. So, but after that, slowly, the alleviation wins. So it slowly alleviates the symptoms fully of the skin disease. That's one factor as an initial reaction of our OmniFresh Plus soap and cream. But it's normal to have that. Uh, Besides that, pwede rin po if a patient has a comorbidity or may ibang sakit po siya, let's say meron po siyang history of eczema or history of an internal problem that can cause skin flushing, yung time po na in-apply yung soap and cream, maaari po nagsabay yung paglabas ng symptoms nitong nakatagong sakit. So, for example, if a patient has a kidney problem, kung may kidney problem po siya, tapos under stress po yung body niya, may times nagkakaroon din po siya ng skin flushing or skin dryness or dehydration. So, pwede rin po siyang magsabay doon sa pag-apply ng OmniFresh. So, I usually recommend na we seek consult to the attending doctor of this patient or this person kung meron po siyang dating sakit. So may follow-up siya doon sa kanyang previous doctor for the treatment of that effect. Pwede po yun. But besides that, ang ating soap at cream, meron siyang initial reaction. Pag ituloy-tuloy niyo lang po yung pag-apply niya, once a day or 2 to 3 times a day as needed, it will slowly subside after 1 to 2 weeks. But yun, either po sa dalawa yung nagkakos nitong flushing initial reaction. Okay. Then answering the second question is regarding hemorrhoids or our external hemorrhoids. Okay. Because our hemorrhoids, basically, ito pong almoranas, they are veins protruding doon po sa ating anal canal or sa butas po ng puwet. So usually may pagmamaga ng ugat ng or veins po doon, thereby producing hemorrhoids. Regarding this question, if OmniFresh Plus soap and cream can alleviate the symptoms of the irritation, I will transfer my response to Sir Ken Elago. our chairman of Axiquate. Sir?
Hello, Ken. Can
Hello,
you?
sir.
Yeah. Okay. Go.
Yeah, can you hear me?
Yes, sir. Loud and clear.
Okay. Well, regarding that question, Doc, uh, dapat ang mga users natin ng ating soap and cream, they should know exactly kung ano yung skin disorder niya. Ang skin disorder kasi meron yan, sabi mo, stress, lack of sleep, tapos minsan superficial contamination from insect bites, and other causes. And this disorder, talagang may virus and bacteria. So, kailangan alamin niya yon. Kasi actually, what happens here is, katulad ng psoriasis, no? Or some acute eczema, dermatitis, actually may involved na viral infection.
Yes, sir.
At saka, so the nice thing with our Omni Fresh soap and cream, the active ingredient of these products are essential acids. People, as we grow older, there are many the building blocks of the body, organs, no? Well,
Yes, sir.
of course, skin is a very big organ, no? That's why importante na yung depletion ng amino acid ng isang tao should be replenished. Now, you can get this from our soap, no? That's why it's important that they are aware of what is their affliction. That's why they should go see a dermatologist. Kasi maraming there's so many skin disorders, you know.
Yes, sir.
You have psoriasis, eczema. Ito ang mga weakening of the amino acids. Then may hives, vitiligo. Ngayon, bago pa yung Steven Johnson syndrome, no? Skin ang mo, no? So, what we can do, actually, ang soap, and they alleviate yung lang ng insect. Boil is mga carbuncle. It's caused by carbuncle, no? Kinakailangan niyan kasi that should be checked by doctor. Kasi nga yung iba dyan, well, right now what they do is they use steroids, no, for these things. Actually, there is a better cure. Like HIV. HIV is a kind of a disease, no? At herpes sortes, no? Those are skin diseases, nagmamanifest sa skin yun. But you cannot just cure that, no, by putting antiseptic. So dapat yan may intervention ng doctor, medical doctor. So but if you continuously use, lalo na kung nag-uumpisa pa lang itong mga skin disorder na caused by virus and bacteria, na-alleviate yan. As a matter of some patients, some people afflicted with kind of skin disorder, they get cured, no? Na-overcome nila. Pero pag medyo malabo na yung matagal na ang case niya, no, kailangan may intervention ng medical doctor. Especially ang psoriasis, no? Like eczema lang, for instance. Maraming klaseng eczema eh. You know, when you talk of atopic dermatitis, yan, kaya natin gamutin yan. Pimple is a skin disorder. Yan, kayang-kaya yang gamutin. Yung mga Steven Johnson syndrome, usually they attack the soft part of the skin, no? Sa mata, sa may ilalim ng kilikili.
Yes, sir.
Na-alleviate yan ng Omnifresh. Pero kasi, if it's already in their bloodstream, binibigyan niya ng gamot na, kasi not all antibiotics can cure this disorder.
Yes, sir.
Dapat talaga, it's important, no, na ang amino acid ng isang tao is complete, no, balance. So, nakakatulong ang Omni. Ang Omni will help, no. As a matter of fact, sa building blocks, no. If you can drink mother's milk, no, that's where you first get the amino acids, no. Like a newborn baby, pagkapanganak yan, you don't feed him anything except mother's milk because very high ang amino acid ng mother's milk.
Yes, sir.
So, but you cannot just, drink mother's milk, buy it from the grocery, no, or the supermarket. Although there is one milk that is very close to mother's milk, and this is the camel's milk, because it cures actually mga autoimmune disorder ang camel's milk. Mataas kasi ang amino acids niyan. There are about 21 amino acids na very vital sa katawan ng tao. Now, ang Omni, ang ingredient niyan actually are very essential amino acids na in part can absorb ng skin. But ano lang, we don't eat that, no. We just apply it and then na-absorb ng pores and it helps. That's why it alleviates.
Yes, sir.
So, yun. So, just tell your potential clients na kung hindi niya makuha agad sa isang application yan, sabon or cream, maabot ng 2 linggo, malamang nasa subcutaneous na yung niya ang attack niya ng skin. Kung kahit niya pa. I hope that, is, the issue. Thank you, Doc. Ryan.
Okay, sir Ken, thank you very much for your response. So, going back to answering the question, for my opinion, besides from Sir Ken's, regarding the external hemorrhoids, because it's also inflammation. Our external hemorrhoids, it's not just the veins that are inflamed, the skin surrounding the hemorrhoid as well. So if we apply OmniFresh plus soap, the soap suds of the soap in our hemorrhoids, it will alleviate the inflammation. It will alleviate the irritation. But of course, it depends on the size of the hemorrhoid. If it's bleeding or if it's really swollen, I would advise that we should consult to a surgeon or a specialist on hemorrhoids besides these. So, ayun po. Sir, na-answer ko ba yung questions niya?
Yes, so far so good. At least I know na anong sasabihin ko sa mga client ng mga ganong cases. Thank you so much, Doc, and thank you so much, Chairman.
Thank you, sir.
We have another question po from Minox Marayag. Doc, pwede rin po ba itong OmniFresh sa mga may warts or kulugo?
So, para sa mga warts or may kulugo. So, basically, we have our warts, or what they call verruca vulgaris. It's the scientific name of this warts. These warts are viral in origin. They are viral. and they are really caused by stress, but not exactly direct contact. So these warts are part of the skin diseases in under viral infection. We usually consider for alleviation purposes as well, OmniFresh plus soap and cream. It alleviates the symptoms such as the irritation, the redness. But regards, of course, it depends on the size of or kung gaano po kadami ang ating kulugo or warts. Our warts, there are warts that are huge in size. There are small or miniature in size. We usually still advise that we go to a dermatologist for the treatment of these warts. Either a dermatologist or a surgeon can really advise the patient or the individual for the removal of these warts. But our OmniFresh plus soap and cream, they will still alleviate the symptoms of these warts. But the treatment, still our medical experts pa rin. So yes, that's about it.
Okay, next question from Miss Amy Aguilar. What are the differences of the ingredients before and the ingredients now?
Okay, that's an interesting question, ma'am. In this question, I would like again Sir Ken to assist me in answering this question about the before and after ingredients.
Abi? Hello?
Hello, Sir Ken. Sir Ken. Okay.
Hello?
Hello, Sir Ken.
Okay.
Okay.
Can you hear now? Wapasok ba ako, Doc?
Yes, sir. Opo, loud and clear, sir. Loud and clear.
Hello?
Hello, sir. Sir
Okay.
Ken. Okay.
Question. Actually, the soap and cream, wala naman walang variation ng dating yung unang lumabas yan, no? But we just made some improvements na maayos para ang discoloring actually it's the same. The amount of amino acid that goes into this product is the same. And of course, we made sure that it's uniformly shaped and kumpleto ang ingredients.
Yes, sir.
Kasi actually, what we are trying to to attack here are the very mild skin diseases, no, like pimples, yung mga dandruff. Actually, you can use this for your scalp, no? Kasi those are skin diseases, eh. So yun, yung katulad ng warts. Ang warts is a viral affliction, no? But if you continuously use this and cream, magagamit, pero mawawala din, aalis din eh. It just fall off eh.
Yes, sir.
So ordinary soap, kailangan mo gamitin because that's a very good soap. So you can use it, mapapatay niya yun. Ang inaano ko lang, what I'm trying to drive at here is, unless na, yung infection, katulad ng mga HIV, medyo kailangan mo talaga ng intervention agad ng medical doctor, no?
Yes, sir.
So, mga katulad ng dandruff, those are minor skin afflictions, no? Nagagamot yan agad ng pimples. Nagagamot, it can be cured immediately. But it will take longer. Instead of 3-4 days, maybe it will take you 2 weeks, 3 weeks, or even a month. Pero mawawala even warts. Unless cancerous, no? Kasi may mga warts na cancerous eh. yung moles, especially, those are skin disorders. So, kailangan ng doktor nun. Is that okay?
Yes, sir. That's okay, sir.
Don't tell them not to worry because the product is passed through a very rigid quality control. And of course, when we starting, we continue our research and development. That's why kung nakita man nila na if they will notice the soap does not discolor that that fast anymore. Of course, when it's exposed to the elements, no, kasi most soap naman are especially virgin coconut oil based, are hydroscopic. It absorbs moisture, so it affects. But the overall effect is the same. Okay.
Okay, sir.
Satisfies the question. Thank you.
Okay, ma'am.
All right, for the next question from Miss Maria Fruelda. Doc, pwede din po ba itong para sa mga may vitiligo?
Oh, yes. Thank you for the question. It's a very interesting question. If we say vitiligo, it is a skin disease that there's a whitening of our different parts of the skin. So there's it's either there are whitish patches or dark patches, because if you say vitiligo, it is flat, smooth or rough skin disease that has many causes. It could be genetic, it could be unknown. There are little studies about finding the cause of vitiligo, but usually they come in patches, they come in small patches, or worse is whole body. In our Omni Fresh plus soap and cream, they ease the inflammation involved in vitiligo, but this is not common. It is not common to have irritation in vitiligo because majority of it has no itchiness, it has no pain, it has no symptoms, but it just stays there in the skin. Besides this, we still recommend consultation from the dermatologist, from the specialist in the removal of this vitiligo, because our dermatologists would have these wise long-term treatment for this skin condition, and still our OmniFresh eases if ever there's inflammation in the skin area with vitiligo. Okay.
Then from our next participant, effective po ba ito sa yeast infection sa chest area?
Oh, if you say, thank you for the question. It's a very interesting one. So if you say yeast infection, it's fungal. Yes, yeast molds are different kinds of fungi that are caused by different factors. One of the factors are if you lack of sleep, if you sleep less than 6 hours, and if you are not taking a bath once or twice a day, so talagang hindi mo linilinis po katawan nyo, and if you're also anxious or you worry a lot, these are usually the risk factors of having an increased yeast infection. Our yeast or fungal infection are usually located in kahit ano pong parte ng katawan. It can be the head or the chest. So, considering these fungal infections, we can still apply our OmniFresh Plus soap and cream in the area where the chest area, the fungal infection is. They will still ease the irritation of this area. Kasi po may mga fungal infections po na makate, masakit, namamaga. Ang ginagawa po ng ating OmniFresh ay talagang ina-alleviate po niya yung iritasyon, tsaka yung pagmamaga. But still, nevertheless, we still recommend either doctors in internal medicine or dermatologists for the treatment of this yeast infection. Okay.
Next is from Miss Amy Aguilar again. Pwede din po ba ito sa may an-an kahit na hindi po Makate?
Yes, yes. Actually, our an is also a different type of fungal infection. It is usually caused by if we're exposed to dirty areas or dusty areas, and tapos plus we lack of sleep. So usually these an is common in with people exposed to different toxins in the environment such as dust or smoke. So usually ang ating an it's also a fungal infection that sometimes causes minsan nagkakaroon ng butlig, nagkakaroon po ng ating yung pagtutubig or minsan nangangati siya. So tendency nagkakaroon siya ng irritation. Nagkaka-irritation siya pag kinakamot natin if we scratch it or we really have this lack of control of scratching that causes the irritation. Regarding our OmniFresh Plus soap and cream, I would recommend its use if there is itchiness, may pagmamaga. Kasi our soap and cream will alleviate the irritation of this an. But for the complete treatment, makati siya or hindi, still, it's best we seek consult to a dermatologist or a doctor in internal medicine for the treatment of an regarding this matter. Ayun.
From Ceres Lito, pwede po ba ito sa may allergy at fungal infection?
Thank you for the question, Sir Lito. So the interesting question is yes, we can use OmniFresh Plus soap and cream in our different and various fungal infections, especially pag meron pong pagbubutlig, pangangate, at saka yung may irritation, we can still apply it even though we have medications from dermatologists or meron po tayong gamot galing sa ating medical specialists or medical experts. Pwede po natin isabay sa ating OmniFresh soap and cream. They will still ease the inflammation, the symptoms like alleviate yung pangangate or ang irritation galing sa ating fungi. Then we will still stick on the same protocol. Now we apply the soap and cream once a day or 2 to 3 times a day as needed. So yes, it's also applicable.
From Miss Arlene, Doc, how about po sa pigsa?
Okay, that's an interesting question. If we say pigsa, it is a bacterial skin infection. It usually is caused by stress or puyat. The bacteria grows in the skin, they multiply, and they enter the skin pores, and they multiply there and cause inflammation, pain, swelling. So if we apply OmniFresh Plus soap and OmniFresh Plus cream, it usually alleviates that pain, that redness in that pigsa. So in that or English, furunkel or pigsa. Yes, it will ease the irritation and inflammation of our pigsa. But still, I still recommend consulting a medical doctor or an expert by prescription of the correct antibiotics. Our antibiotics are still the mainstay treatment of our furunkel or ang ating pigsa. So yun.
Next question po from Jenard. Ano po magandang advice during the first phase of skin reaction? Paano nila ma-lessen yung itchiness? Some ginagamit nila VCO to ease it. Pero ano po ang mas magandang i-advise? Thank you po.
That's a very interesting question. Thank you for that question, ma'am. So regarding on the first phase of this skin reaction of this flushing, we originally recommend the continuous application of the soap and cream. Though if ever there's this discomfort, it's normal, it's okay. We will, again, na-mention ko po kanina na ang reason po nito ay kasi po, yung ating natural ingredients, yung ating amino acids, lumalaban siya sa free radicals. So parang there's a battle between the good and the evil elements. So that's how I cite as an example for this initial reaction. But it eventually goes slowly. Mawawala po siya yung itong irritation. VCO is also a natural ingredient, which is a virgin coconut oil. It also alleviates the irritation and the redness, which is good. So again, as I mentioned earlier, there are no contraindications for the soap and cream. So even if you apply the VCO in tandem with the soap and cream, the irritation, the flushing will be reduced faster. And besides this, we also recommend the application of warm water. If you take a bath or if you wash your hands, you use warm water. It will also help the reduction of this redness. So usually 1 to 2 weeks po siya, but usually sooner. But if ever persist yung flushing, I will still recommend we consult a medical doctor as well.
Next question po from Ms. Amy Aguilar. Pwede rin po ba ito sa may keloid?
Keloid is a type of scar. It is a scar, peklat po siya, that is the swelling or the increase in epidermis. Remember my basic anatomy a while ago. The epidermis is the outermost layer of the skin. Our keloid is the one that's it is an excess healing tissue. So if kung may sugat po kayo from a trauma or galing pa sa surgery, talagang yung ating keloid, siya po yung overgrowth ng scar tissue. So just like similar as hypertrophic scars, keloids and hypertrophic scars are considered as one of the concerns in the skin, but it's going to be a skin problem if it's always inflamed, if it's always infected, or it's always itchy. So considering our Omni Fresh Plus and soap in relation with our keloid, it will help alleviate the irritation or the redness of this keloid. I would only recommend to use it if the keloid is red or if it's itchy or infected or inflamed. Our OmniFresh soap and cream will alleviate the redness and the irritation. But regarding to the removal or the cure or removal of our hypertrophic scar or our keloid, I would still recommend the dermatologist's expert advice.
Next po from Miss Arlene. May client po ako na may skin allergy. She uses Omni po pero sabi niya mas lalo kumate. What advice po ang ating masasabi po sa kanya?
Okay. Actually, it depends on the situation. Again, I have this, as I mentioned a while ago, if there's a skin irritation, kasabay po sa paggamit ng soap at cream, two causes po yan. The two causes are, one is, pwedeng po meron yung initial reaction or yung flushing, yung paglaban po ng amino acids sa ng antioxidants, kasi our amino acids are antioxidants and the free radicals. That's one. Or second is, pwede pong may comorbidities or there are other considered illness or health problems po ng individual. So kung meron pong ganitong problema, we could consider either the individual or patient has another cause, ibang cause ng kanyang allergy, pwedeng galing po sa food, or pwede rin pong puyat siya, or pwede rin po na talagang nagkaroon po siya ng allergy sa gamot. So, pwede po yun yung cause ng irritation if ever ma-prolong itong irritation. Or he or she is undergoing the initial reaction of the Omni Fresh soap and cream, in which now it's still, kung yun po yung cause, it's still considering continuation niya, then the irritation is still there. We can still observe for 1 to 2 weeks. But if ever it persists, I would still recommend she may seek consult to a dermatologist then.
Next question po kay Sir Linox. Doc, is it okay kung halimbawa si client na may skin disease would only purchase yung cream? Would it still be effective to be used kahit wala yung soap?
Okay, that's sir is ma'am, is an interesting question. I would like to transfer my response to Sir Ken. Sir Ken. Okay. Sir Ken?
Can we have the question again?
Okay.
Do you hear me? What is the question? Will you please repeat the question?
Ay,
Hello, the question po is it okay kung halimbawa si client may skin disease and he or she would only purchase yung cream? Would it still be effective to be used kahit wala po yung soap?
Ken, nakamute ka. Ken, nakamute ka.
Yeah, do you hear me now?
Yes, sir. Loud and clear pa.
Actually, for most skin allergies, they should use more the cream lotion. Kasi iba yung may leave-on effect yun eh. You don't wash that. No? We can bake with the Omni soap. Kasi mas concentrated sa skin, mga allergies, no? At mga poison ivy, no? Pag nagkit ka sa halaman, some rubbers and some plastics, can cause allergy skin. So if you use the cream, mas mabilis ang recovery, ang treatment, ang cure. So they should use more the cream para sa mga allergies. Even for dandruff nga I recommend na they should, apply on their scalp. Kasi those are minor skin afflictions. Okay?
Okay, sir.
It will take a little longer, pero magaling yun, mapapatay niya. Kasi active ang amino acid talaga ang Omni Fresh and cream.
Okay, ma'am.
All right. Thank you po, Sir Ken. Then, for the next question po, Doc, how about po sa mga insect bites like nick-nick?
Okay, that's an interesting question. So usually, insect bites result to allergy. We have redness and the swelling of our skin tissues if we have this insect bites like from such. Usually, we still can apply OmniFresh plus cream and soap for the alleviation of this irritation or allergic reaction from these insect bites. So same application. Besides that, regarding to the treatment or the removal of the allergic reaction of the insect bite, we still seek consult to a doctor who can be from an internist, internal medicine doctor, or from a dermatologist.
Next question from Miss Arlene. Doc, meron po akong client na nagsabi na di sila natulungan ng OmniFresh, bagkus lalo pa daw pong lumala. Ano po ang magandang pagpapaliwanag na ibibigay po natin sa kanila? Pwede po ba
Okay.
isabay ang OmniFresh sa ibang skin products like skin toner or moisturizer?
Thank you for that question, ma'am. So that's a very interesting question. Actually, our OmniFresh Plus soap and cream is requires patience. It has we still it's also no, it is it's highly organic. It's has natural ingredients in which that it is safe to continue for its use. There's a possibility, pwede pong may chance na pag hindi parang wala pong nagiging epekto or tumatagal po yung pag-alleviate, there could be other health problem concern. So let's say meron po tayong allergic reaction. Pwede pong may ibang cause. There could be another cause of its irritation. It could be there would be a lack of sleep. Pwedeng kulang po siya ng 6 hours ng tulog. Pwede rin po na lagi po siyang exposed sa mainit na area or yung biglang nauulanan. So, or pwede rin po meron po siyang nakain na kung saan po siya allergic dati. So marami pong actually comorbidities or other health problems, health conditions to consider. Kaya po hindi nawawala itong allergy or skin irritation. And regarding this matter, we still recommend to seek consult to a dermatologist as well if symptoms persist. Then besides that, it can also be it can also be applied to our OmniFresh soap and cream. Pwede po siya isabay doon sa mga other soaps, other lotions, as well as even other liquid formulations, other solutions or disinfectants like alcohol. So it's still safe if it's pagsabay-sabay po sila. There are no contraindications because iba naman po yung ating mechanism of action ng ating OmniFresh soap and cream doon po sa mga ibang lotions, sa ibang disinfectants and etc. So it's still safe.
Next question we have from Marvin San Jose. Doc, kailangan po ba dito tuloy-tuloy ang gamit ng product para mawala talaga ang skin disease mo? And may age range po ba sa paggamit nito?
Okay, that's a very interesting question. Thank you for the question. The first question, ma'am, is to answer the first question is yes, you can use it as long as you like. I would recommend we use the soap and cream as needed if ever there's a presence of a skin problem or skin irritation or any symptom of any skin disorder or skin disease is present. We will continuously apply our OmniFresh Plus cream and soap. There's no limited time of use. You can use it as needed. So as I mentioned a while ago, you can use the soap and cream once a day or 2 to 3 times a day as needed, but as long as you like. Besides that, I would recommend if it's only needed, kung meron lang po tayong pagmamaga, pangangate, or meron po tayong irritation, so that's a time we can use it. So mas economical. Mas economical ang use, there will be less consumption, and tsaka mas magtatagal, mas mapoprolong yung use ng ating purchase soap and cream. Then the second question to answer, the question is from what age na pwede start mag-apply ng soap and cream safely, until what age? Regarding this question, sa age po na to, ayun, Sir Ken, is it like, we would like to to seek for your answer about yung age range na safe po, kung anong age po safe po yung ating cream at soap.
Ken, paki-unmute. Unmute mo lang, Ken. Paki-unmute yan.
Hello po, Sir Ken. I guess.
One moment.
Hello?
Yes, sir. Sir.
Can you hear me now?
Yes, sir. Yes, sir. Loud and clear po.
Okay. Regarding sa age, actually yung soap and cream can be used even for infants eh.
Yes, sir.
Kasi topical lang naman yan, no? That is, I say, neutral yan. In other words, non-toxic yan. Maski sa bata, mga kagat ng lamok, pwede mo lagyan ng cream. So that is actually very neutral product. Ang lang dyan, ang active ingredient dyan talaga is the VCO and the amino. So there is no danger. As a matter of fact, yung kanina, just to elaborate, no, yung mga akala nila lumalala yung sakit, yung kanilang kate, tuloy lang nila, use more cream. I would recommend na they should apply more the lotion, yung cream. So, kasi mas mabilis makaka-recover. Kasi as you say, some afflictions, minsan nakapasok na yan sa sa dermis, no? So para pag mas mabilis ng amino acid. Kasi may deletion na ng skin amino acid dyan eh. So just use more. Kung nakikita nila na medyo parang lalong namaga, yan nila cream na lang para mas ma-over sa sweat kasi mga allergies. Kasi yung actually ganun yun eh. Actually genetic din yun anyway, autoimmune disorder din yun. Pero sa yung mga katulad ng mga hives, I would recommend na maggamit sila more ng cream, yung lotion, than the soap. But of course, you can always, they should bake with the soap, no? I hope that answers their question.
Yes, sir. Thank you, sir.
Alright, for our last question, Doc, pwede din po ba ito gamitin kahit wala pong skin disease?
That's a very interesting question. Thank you for that question, ma'am. Yes, you can use it even there's no skin disease because number one, it has the Omni Fresh soap and cream has natural ingredients, which is again coconut oil and essential amino acids. Our soap and cream replenishes the essential amino acids present in the skin. So it helps on the revitalizing of the skin. Every day in our life, our skin is naturally shed off. There's always this time that our skin reduces its cells because of exposure to exposure to different elements outside, exposure to different extreme temperatures. So araw-araw nababawasan po yung skin cells natin due to these free radicals. These free radicals are the ones that reduces the cells in the skin and causes cell damage. So if we use our OmniFresh soap and cream every day, kahit wala po kayong skin disease, it is also recommended for the prevention side, in a sense of keeping our skin healthy, in check, hydrated, and intact. So with or without skin disease, it's okay. It's good to apply the soap and cream.
All right. That's all our questions for today. Maraming salamat po, Doc. I'm
Okay.
sure madami pong natutunan ng ating participants. And also, Sir Ken Elago, maraming salamat po sa
Thank you,
pag-answer po ng questions. Ayan. So again, mag-thank na lang po tayo sa ating kay Dr. Raymond Antonio De Hoya. And don't worry po sa mga late po na nakarating, ipopost po ang video recording na ito sa ating GFox official group sa product training album in case na gusto niyo pong balikan. So maraming salamat po sa inyong panonood. Goodbye po.
Thank you.
Thank you, Doc.
Ingat.
Maraming salamat po.
Salamat po.
Stay safe. Ingat sila.
Thank you, Doc.
Okay. Ingat.
Thank you, Lord.
Hello, Tito Andy. Ay, Tito, hello pa.
Congratulations!
Thank you. Thank you po.
Congratulations, ha?
Ang galing mo! Kaya.
Thank you po, Tita.
Ganda. Okay. Mas magaling, hintayin mo yung dadating na pera mo.
Tita, magaling po yung director.
Okay.
Magaling po yung director na I was really trained well by our director.
Ano, pakilakas lang para marinig ng pamilya ko.
Ay, bali Tito, I was really trained well by our director, si Direk Andy.
Galing ako.
Thank you po, Tito.
Hindi na engineer. Direct Andy na lang.
Yes, Tito. Yun po maalala ko.
So, again, in a nutshell, you've done a fine job, my friend.
Thank
I'm happy. We're very happy kasi you've answered almost everything. And then you have consistently answering questions na alleviate, help, ease, and please consult the doctor.
Yes, Tito. Advice
Pero si
niya.
Doc Rai, si Dr. Ken, sabi mo, magsasabi ng pure. Sabi ng pure eh. Oh, but then, congratulations.
Thank you, Tito.
Very nice. Alright. Okay, nasa YouTube ka na niya. Alright? Facebook. Okay.
Yes, Tito.
Job well done.
Thank you, Tito.
Alright? Job ito. Tumatawag na si
Okay, po.
Okay. Bye-bye.
Bye, Tito. Ingat po
Thank
kayo.
you.